Hi, this is Kiran Kaur. My student ID is 109322248. Today I'm going to do the how to do assessment as per Professor Dollars. So firstly we're going to do the 360 of the room. Okay, so I'm going to start. Hi Mr. Pascal, this is Kiran. I'm going to be your nurse for today. So may I know your full name and date of birth please?
My full name is Upasana Sharma and my date of birth is 9th March 1995.
Okay, so doctor has told me to do a how to do assessment for you. Is that okay with you?
Yes.
Okay, so I've done my hand hygiene, I've given a privacy to my patient. So firstly, I'm going to do the neurological assessment. In that, I'm going to assess your conscious level. So I'm going to ask you a few questions. Okay? Do you know where are you now?
I'm in Brampton right now.
And do you know which is you're going on?
2024.
And then do you know who is the Prime Minister of Canada?
Justin Trudeau.
Okay, so the patient is well conscious and well oriented to time, place, and the year, place, and the person. So next, I'm going to do the Perla assessment for the patient. Okay, the Perla, I'm going to start with the diameter. Okay, so I'm going to check the dilatation and constriction for the Perla. I'm going to focus here. Okay, it's constricting and well dilating. So I'm going to do the accommodation. I want you to focus on this pan, okay? Okay, so the patient's Perla is well is functioning properly. And then next I want you to give me a bright smile, please. Okay, and then I want you to repeat some words after me. Can you repeat? Today is Sunday.
Today is Sunday.
Okay, so the patient's speech is clear. Patient has no facial drooping, and then patient is well conscious. So can you stand up for me? And can you extend your extremities? And close your eyes. Close for 10. Count for 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, so you can have a seat. Yeah, the patient is well conscious and then well orientated and has full command and control over extremities. Next, I'm going to do the respiratory assessment for you. So for the respiratory assessment, I'm going to inspect. So can you turn that way? And then I want you to take a deep breath for me, okay? I'm going to touch you. Can you take a deep breath? Okay, so the patient's lungs are expanding properly and then it is bilateral symmetrical. So secondly, I'm gonna assess I'm gonna auscultate the lung sounds. So that was done anteriorly. Can you come back to it? So checking posteriorly. So lung sounds are clear, no wheezing sounds have been noted down, so the patient's lungs are doing okay. Next, I'm going to do the cardiac assessment for the patient. So to start with the cardiac assessment, I'm going to auscultate the cardiac sounds. So, to assess the cardiac sounds and to listen to the cardiac sounds, we'll assess five valves for the heart. To start with the first one, that is at just below the clavicle between the first and third intercostal space, that is second intercostal space, that is aortic valve at the right side. And there is a pulmonary valve here at the second intercostal space at the left side. Then comes the Erb's point, that is at the third intercostal space of the heart or the sternal border. Then comes the tricuspid valve, that is at the fourth intercostal space, also known as lower sternal border. Then comes the mitral valve, also known as the apical area of the heart, where we can also assess the apical pulse. We're gonna assess it for 30 seconds. apical pulse for the patient. The reading is 78 beats per minute. Next, I'm gonna assess the abdomen of the patient by inspecting, auscultating everything. So I want you to lay down for me, please. So I'll check the abdomen and then skin and everything. So by checking the symmetry for the abdomen, I'll go side of the back to check the symmetry. Okay, so the counter is flat and then the abdomen is properly symmetrical. So I have inspected. So secondly, I'm gonna auscultate the bowel movements for the patient. Let's start with the right quadrant. Right. Bowel movements are active. I'm gonna palpate. So if you feel any kind of pain, just let me know while I'm palpating. Okay? I'll palpate in a clockwise motion. Are you doing okay? Okay. So next I'm gonna do the percussion. Sorry. Okay. So there is no masses and tenderness noted down, and then the percussion, there's a tympani for that, and then the patient's abdomen is fine. Then next I'm gonna do, okay, so can you sit down? So next I'm gonna go for integumentary and skin, and then extremities. And so for that, I'll ask you a few things, and then I'll ask you to do a few things. Okay? Do you have any kind of pain in your body? Okay. So, can I assess your skin to check the integrity? Okay. So, the patient's skin is properly integrity. Skin has a good integrity, which is a sign of good hydration. And so there is no edema, and then no pain noted down. There is no bruising, and then there is no bruising and no breaking of the skin up there. So I'm gonna assess the extremities first for you. Okay? Can you hold my hands? Okay. Can you pull my hands towards you? Okay. Can you push my hands away from you? Can you exert a force on my hands? Okay. Can we do this way? Can you resist the force? Okay. We will do the same for the lower extremities. Can you put the force at the back side? Okay. Can you put a force on my hands? Okay. So patient has a good force of extremities. That is the motor sign is 5-5 motor sign. And next I'm gonna do the pulse landmarks. First we're gonna do the carotid pulse. That is, we're gonna do one by one. We can do the both first. It's up here below the jawline. That is between the trachea and sternocleidomastoid area. That is a carotid artery. We're gonna assess this. Same with the other side. Then we're gonna do the radial pulse. The same here. Then we're gonna do the dorsal peris and then posterior tibia. Dorsal peris is about the anterior part. Here. And then posterior tibia is behind the foot. Here. Okay, so the pulse sounds are okay. Then I'm gonna do the capillary refill for the patient. So can I have your hands? Can I do the whole? I'm gonna do for the toes. Okay, so capillary refills is in 2 seconds. That means it's regular and it's normal. The muscle strength is 2+. So the patient is well conscious, and then everything is okay with the head to toe assessment. That's all. Thank you. For the last, we're gonna do the 360 of the room again. Thank you.